are Sint Maarten. You are Sint Maarten.
The URSM, the Unified Resilient Sint Maarten Movement, being a political movement, will be hosting a weekly radio program called You Are Sint Maarten, every Wednesday from 6 to 7 p.m. on Radio Mix 94.7 FM. I myself, Dr. Messalina, the political leader of URSM, will be hosting this radio program in which current issues, actualities and general topics will be discussed with the people of Sint Maarten. So join us every Wednesday on Radio Mix 94.7 for our radio show You Are Sint Maarten.
You are Sint Maarten. You are Sint Maarten.
Dear people of Sint Maarten, good evening. Welcome to your radio program You Are Sint Maarten on Radio Mix 94.7 FM. I myself, Dr. Messalina, will be your host in this radio program. As you know, I'm the surgeon in Sint Maarten, and as I always say, since 1999. And since October 2021, I'm the political leader of the URSM, the Unified Resilient Sint Maarten Movement. And this political movement will contest the upcoming parliamentary elections of country Sint Maarten. As you know, URSM stands for putting the people and, as a matter of fact, the country above self. And the URSM believes in educating the people of this country. And that's the reason that we are now busy with this weekly radio program. We are presenting this radio program called You Are Sint Maarten. Actually, it's the abbreviation of the letters URSM, Unified Resilient Sint Maarten Movement. And if you analyze critically the URSM, it also stands for You Are Sint Maarten. And that is hence the reason that the group forming the URSM decided to start with the radio program, giving it the abbreviation name of You Are Sint Maarten, and this way present the people of Sint Maarten a informative radio program on a weekly basis. We are presenting a radio program in which current topics, community developments and issues and general matters concerning the people of Sint Maarten are discussed. Today we decided to invite a very special person in our radio program. And why do I consider him a special person is because he is day and night busy taking care of the next generation of Sint Maarten that, as a matter of fact, will become the power and the empowerment of our country. And we have to treat the younger generation good because as time is flying, at a certain moment they will take over and they will be the face and the future of Sint Maarten. Everybody is asking now, who is this great invitee that we have today in our radio program? And today we have with us Dr. Tilanus, the pediatrician, actually the only pediatrician that is here on the island taking care day and night of the kids, the children of Sint Maarten. Dr. Tilanus, good evening for us and for me. And also from the Unified Resilient Sint Maarten Movement. It's an honor and a pleasure to have you as an invitee, as a professional in our radio program. Welcome, Dr. Tilanus.
Thank you. Good evening.
Dr. Tilanus, once more, thank you for taking your busy time out, because we know how busy we can be as doctors for the country Sint Maarten, and although that, because of your passion for your profession, you still decided to take some time out to be with us in our radio program. Dr. Tilanus, you have, of course, an impressive history. I would like you to use your biography, actually, as a background context to give the people, the audience, a impression and some information about who is this Dr. Tilanus.
Yeah, thank you, first of all, very much for this invitation. It's a great honor to be here in this program. To answer your first question, my medical career started in the Netherlands, where I was born and raised in the city of Utrecht. I followed my medical trainings, my medical school, and after that I got the opportunity to work as a pediatric resident. It became actually quite early in my medical school already clear that my interest was focused on pediatrics. In particular caring for sick newborns. And I had the opportunity to start working to do residencies actually in the St. Elizabeth Curaçao Hospital, which was actually supposed to be for 6 months, and eventually that was prolonged to in total 2 years.
Okay.
And I think that's where my passion for the Caribbean has grown throughout those 2 years, and my further interest also to return after my residencies back to this region. So in 2008 I returned to the Netherlands, where I worked in several hospitals and following pediatric residencies, and eventually I finished and completed my residencies in a children's clinic in Germany. So actually I'm a German pediatrician,
Okay.
Kinderarzt voor Jugendmediziner, Facharzt voor Kinder- und Jugendmediziner when they speak it in German. And I decided to return to the Caribbean. My initial plans were actually to return to Curaçao, but they did not have at that moment a place available. And I knew also that my colleague who retired about 2 years ago, Dr. Pieter Ovringa, which most people on the island know, who has been working here for over 2 decades by himself, was working by himself. So actually I emailed him in February 2013 with the question if he could help me to advise me how can I start up, how can I settle down here in this region.
Mm-hmm.
And he emailed me in less than 15 minutes back and eventually helped me to get in here in Sint Maarten Medical Center, where I started in May 2013, and up till now I'm still here working with a lot of joy, and every day is different, every day is challenging.
Great. And actually you're almost 10 years actually serving the kids of Sint Maarten with your knowledge and your profession. Very good. Dr. Tilanus, we are talking about a pediatrician. We call that a children doctor. What exactly does that all compromises on practically if we say that you are a pediatrician? What does it what entails of what you're doing for the kids here in Sint Maarten in the hospital? Explain us a little about your daily activity, how it works, and what you do for the kids in Sint Maarten.
Yeah, well, the term pediatrics is actually is everything that is the treatment and diagnostics, the treatment of children in the range from 0 to 18 years old. And that is often misunderstood. And some people, like general practitioners, they sometimes refer for certain problems to adult doctors already at the age of 15, for example. But basically all pediatric problems are in the age range from 0 to 18. So basically the pediatrician is an internist for children, which diagnoses children with blood disorders, children with heart defects. We also treat children with lung problems and so on. So actually all adult specialties that we see, we also have them more or less for children as well. So the general pediatrician is like an internist for children. And I think an important role of our work, and I think that compromises about 40% of my daily work, is neonatal care, newborn care, in which also premature babies are being taken care of. So that is also quite unique aspect from this specialty.
So actually you're covering the healthcare from day one that we are here on Earth until we reach the age of average 18 years. That is actually your scope of age that you deal with as a doctor in Sint Maarten Medical Center.
Correct. It depends a little bit on the country where you live. Some countries have pediatrics from 0 to 16. There are also specialties that countries where the specialty reaches to 15 years of age. So it fluctuates a little bit depending on the country where you live.
Okay. Dr. Tilanus, I'm a parent and I have a sick child. Can you explain the parents of Sint Maarten, for the sake of clarity, what is the best way once you have a sick child in the house What is the best way actually to take care that this child is being taken care of? Must I go to my family doctor? Must I run to the emergency room? Must I try to get you on the line? Can you explain the people of Sint Maarten, especially the parents that can be very concerned, and of course it is very normal to be concerned when you have a young child in the house, but explain the mothers and fathers what's the best way to go about this?
That is a good question. Of course, every parent that has a sick child at home is concerned. And the most common reason to visit the pediatrician is, for example, fever. There's always a lot of fear for fever, so to say. Of course, a lot of things can be done at home, giving medications, self-medication like paracetamol, push-ups and those things, and people can observe usually a lot of things. But if the things don't get better and you don't see an improvement, that's where concerns start to raise, and that's where people start to search for medical help. Basically, the rules are that people first present by their house doctor to obtain a referral letter, and then they are seen by the pediatrician. Of course, that is not possible in the night hours or in the weekend. So in acute cases, in those moments, patients are being seen and evaluated in the emergency room, where a lot of people go there also. With the first problems that occur, they usually go there.
Okay. And the emergency room doctor looks first, and in case he or she finds that it's a very specific case, that the pediatrician should be consulted, and then they will call you.
Correct.
Okay, that's the way it goes. Dr. Tilanus, I assume that most of the time you're the only pediatrician on the island. Once in a blue moon, I see that there is some persons falling in for you or assisting you, but in general, you are the guarantee of continuity for the pediatric care for country Sint Maarten. Sometimes I look at you and say, wow, man, this guy is working day and night for the kids of Sint Maarten. Explain us, how does a working day be for you? How does it look? Explain us.
Yeah, so we meet up at 7:30 in our conference room every day, where we see the other specialists, in which we share the patients. We discuss the patients that were admitted over the night, or specific patients that need a further, let me say, discussion among all those people present. So all the specialists that were on call, they present in that meeting what is new and what needs to be discussed. And after that meeting, which is usually about 30 minutes, around 8 o'clock in the morning, we go to the pediatric ward, where we first visit our newborn station. That's the neonatology department for those babies that are in the incubator. So that accounts the premature babies, sick newborns, or babies that are simply too small. That's another part of my work, is too small sized babies. And then together with the nurses, we do our rounds and we make plans for those babies for the next 24 hours. And then we follow the course on the ward and see the older children that are admitted with their problems. And then we visit the maternity ward, where we examine all newborns that are being born. So all newborns are assessed as well by the pediatrician. And then it's usually close to 9 o'clock, so I have to make sure I be there on time to start my outpatient department clinic, where a lot of people in Sint Maarten probably by now have been, where consultations take place, where questions from all kinds of options can pass by.
Okay. So you have a quite busy day, because sometimes I see you walking up and down, trying to serve everybody. I say, wow, because I know also, because I'm your colleague, that actually you're the only pediatrician on the island. So actually you have to be accessible, you have to be reachable for the kids 24 hours a day. And I have great respect for how you're sharing your life with the community of Sint Maarten. For what, once more, I would really want to thank you for your dedication for the kids of Sint Maarten. Dr. Tilanus, you have worked, of course, in Europe. You have worked in Curacao, and now you are the only pediatrician in Sint Maarten. I do believe that it's great to be a doctor on an island, and especially on Sint Maarten. What makes it so unique for you as a pediatrician to be a doctor taking care of the kids on the island of Sint Maarten, because at the end of the day you're alone. You do not have academic centers with you. That means that everything that is presented to you will have to have a solution for. I think it's quite challenging every time again for you to make sure that you make the right decisions for the kids. And I have a great respect the way I see you deal with all the pathologies, as we say, the diseases that you are encountered with. How do you experience it yourself to be a pediatrician on an island?
Well, first of all, I'm not all the time by myself.
Okay.
It happens sometimes, but most of the time the hospital is able to find also a second pediatrician which has been flown in from abroad to either replace or to be there as a second backup, so to say. So we try to work with 2 pediatricians full time. Together you need to make sure that you make the right decisions. Some problems are able to be treated here properly. Some of them are simply too complicated. For example, if a child has a severe, let me say in the worst case scenario, a brain tumor, that's definitely something that cannot be treated here and must be sent abroad. So we need to be good in contact with our overseas colleagues. I'm talking about Panama, but definitely also in Curacao. The options in Curacao are also much more extensive than here by us, and definitely also with Colombia. So we are in good contact with those overseas centers. We know what their options are, and I find it challenging to know for which problem, which hospital to contact, and what would to be the best place for that patient to go to make an optimal referral situation in which all the problems are solved at the same place at the same time, and not going from one country to the next or coming back and only half of the problems are solved. So you try to optimally use a doctor's referral abroad to make sure that if a child has multiple problems, that all those problems get the right attention from the different subspecialties.
And Dr. Tilanus, if I understand good, most of the time your options that you have as a choice to refer a kid that is sick is most of the time, if you cannot get through here with the complexity of the disease, you feel that you do not have everything at place to take care of this kid, then your referral centers are most of the time Panama, Colombia, or Curacao.
Correct.
Do you sometimes deviate to Aruba too, for example?
I would definitely be open to that if eventually the insurance decides where the patient is going, so we can give actually only an advice. If patients go with commercial airlines, then they have to transit in Curacao in order to reach to Aruba. It's not a direct flight from here. So I think those practical problems also determine whether patients are going to Aruba or not. But I know from internal medicine colleagues that they do refer. After Irma, for example, a huge amount of kidney patients which needed dialysis were flown out to Aruba, and there was a good relationship with the Horatio Odubo Hospital in Aruba as well.
Aruba. Okay. Dr. Tilanus, in the beginning in our conversation you said something about the incubators that you have in the children ward. How many incubators do you have there on the ward?
Basically 6. There is 1 or 2 in stock, so to say, in case that one of them shows failure. But basically we are operational with 6 incubators. Next to that, the department is equipped with 2 mechanical ventilators for those babies, for example, or children, but usually small babies that are too sick to breathe on their own. We are able to overtake the respiration with a ventilator, waiting for a team to pick up and transfer the child to, for example, a neonatal intensive care.
But it's nice to know that Sint Maarten is growing in its facility to offer the maximum possible care for the children, especially the newborns. And it's nice to hear that nowadays at your department it's possible to intubate the small ones that have some challenges with their breathing, that you can connect them to the respirator. I think it's great to know that Sint Maarten Medical Center is moving forward, and it's growing it in its potentials to try to help the kids as good as possible. And it's of course very nice to hear that nowadays we have incubators at the children ward, and we have also the facility and the possibility and also the knowledge to intubate and connect the kids to the ventilator in case they are challenged by their airways or by their lungs, of course. That's nice to hear. Dr. Tilanus, it's very, very interesting to hear all what you are doing. But in daily practice, you always look on a regular basis on, or you actually, your big part of your job is to sit and do consultation and look at the kids of Sint Maarten. What are, in your vision and experience, the most common problems or diseases or abnormalities that you encounter in daily practice on a daily basis here in the Sint Maarten Medical Center?
Well, the majority of pediatrics is to monitor growth and development. And if you look every day at those growth charts, you see a lot of kids with overweight. So obesity is definitely one of the top 3 problems, if not number 1.
Just mention me the top 3. For you first is obesity.
I think on the second one we have respiratory tract infections.
The respiratory tract infections is for you number 2, and do you have a number 3?
And I think number 3 would be children with what we call in the island stomach flu, or gastroenteritis with dehydration.
Ah, fantastic. You know why I said it, Dr. Tilanus? Because I think these are interesting topics, and they're frequently you're encountered with those diseases to treat. I think we should go a little deeper in these topics, but I see that time is running on us, so we will have to take a small break, and we will be back in a few minutes. Dear people of Sint Maarten, once more good evening. Welcome to the second half of our radio program, You Are Sint Maarten. As has been said in the first half of our program, today we have with us the pediatrician, Dr. Tilanus, with us. And we have been discussing a few interesting topics in the pediatric care in country Sint Maarten. And now we are busy with our second half of our program, and as we were discussing at the end of the first half, we spoke about common problems that are being presented to Dr. Tilanus on a daily basis, being the obesity, the overweight, the respiratory tract infections, and the gastroenteritis. So I would like to touch base a little on these 3 with the pediatrician, because I think it's good for the people of Sint Maarten to know a little more about, for example, the obesity, the overweight of our children in Sint Maarten. Dr. Tilanus, explain us a little about the challenges that you have with overweight for your kids in Sint Maarten.
There are limited options for exercising. There are no pedestrian sidewalks, at least not very much. So the options for people to take, for example, the bicycle to work or to school are quite dangerous, actually, as we all know on this island.
And limited, of course, yes.
And limited. So you would like to see some improvement there, that children are challenged to use more a bicycle, or parents can bring their children to school with simply a bicycle. Exercising after work or school can be also promoted, going to sports clubs, etc. Because obesity is still very simple, and combination of a lack of exercise and too much consumption of, in particular, carbohydrates. So excessive intake of energy drinks, sugars, ice creams, these promote obesity, combined with a lack of physical exercise. So, it's easy talking to say start moving, start exercising and eat less. It doesn't work like that. It's a gradual process, and parents, of course, need to be aware also that obesity in early infancy, childhood, is translating towards a more serious problem in the adult age group, and that we're talking about an early onset of diabetes, hypertension, and the risk of stroke before the age of 55. So cardiovascular risk factors are developing already in the pediatric age group, meaning also we remain vigilant on that, and not only on the obesity. We need to screen for hypertension, also high blood pressure, in medical terms hypertension. We have to be vigilant and continuously monitor in the school age group. Are they showing signs of increased risks for later on to reduce that risk on cardiovascular disease, which is very high on this island?
You know, Dr. Tilanus, I'm very glad that you touched base on the need for more sport activity and facility for more physical activity like biking, that is at this particular moment very dangerous in the traffic of Sint Maarten. And it's good that you say that, because we from the URSM, the Unified Resilient Sint Maarten Movement, do have in our manifesto that we would like to develop the after-school activity for the kids of Sint Maarten, because every time again I realize that once the kids come from school back, they just finish fast their homework, and after that you see that they do not have a option to keep themselves busy in a healthy way. And I do believe that we have to dedicate more attention to the development of after-school activities and actually sport facilities for the youth of Sint Maarten. And I do believe this is a priority for Country Sint Maarten. And actually, I do not understand when they are discussing the budget of Country Sint Maarten. There's never a reservation of a amount of money to try to develop sport institutions and facilities to keep the youth of Sint Maarten in a healthy way busy with activities after the school program, the daily school program. And of course, on the other side, the obesity, actually the overweight that we're talking about is, as you said, related to our eating pattern, of course, how we eat. And we do like carbohydrates here in our food, and we like to eat a lot of bread, we like a lot of sodas, a lot of sugar, a lot of candies, and of course these things are very delicious, but at the other side they are very, very threatening for a healthy human body. And so I can imagine that you have your hand full by educating the parents of those children.
So you need awareness. Awareness is the most important part. So some parents say then in the office, like, I told you so many times to the child, and then I think like now you're projecting it all on the child. It should be more like, yes, I'm aware of what you're saying, and we're going to work together instead of accusing anyone.
Yes.
It's something you need to do together.
Yes. You spoke also about a very common disease that you treat on a daily basis, being the respiratory tract infections. Can you tell us a little about that?
Yeah, well, it doesn't matter which country you are. Viral respiratory tract infections are far out the most common reason for children to have infection of the airways with lots of mucus production, coughing, and sometimes they have wheezing. So that is a picture that we see very often, especially in children that are going to daycare, where they are continuously exposed to those viruses. In a certain sense, it's very important, because they have in that way the opportunity to be exposed to many different viruses, creating a lot of immunity towards infection. So it's very important. The question is this also related to the dust that we have from the Sahara? The Sahara dust is playing a role, and it's very active. We see it on our windows, on our windshields, on the cars, for example, in the morning. And we inhale that very thin dust particles, and we definitely are convinced that the Sahara dust does play a role in these respiratory symptoms. But to what extent is not clear, but it definitely needs further investigations. The question is also in Sint Maarten in particular, for those that live around the dump of Sint Maarten, where a lot of garbage is being burned and destroyed, if the fumes coming from that are also responsible to a certain extent to the respiratory state, the respiratory conditions of infants and children. So that's also something that I think at some point needs to be investigated. How safe is that for the respiratory condition of children in general.
Mm-hmm. And the third one that you were speaking about that you encounter very often too in your outpatient clinic is the gastroenteritis. Can you explain the parents what are actually the signs and symptoms of
It's
this gastroenteritis?
quite funny actually. It's a new term that I learned from Sint Maarten parents, is they call it stomach flu, and which is actually quite a good way to describe the problems. There's usually vomiting because the stomach is upset, and indeed it's in most cases a viral infection in which the stomach becomes upset with vomiting, and in most cases also diarrhea. All these problems they solve on their own. They're self-limiting, as we say, but the most important reason that we can get into trouble is when they don't drink enough anymore because they are sick or not able to keep their fluids, their milk or whatever you offer them to drink is not be able to kept inside, and then they run into dehydration. So dehydration is something that needs to be on the top of your mind as pediatrician. Actually, in all child, each child problem, acute problem, can lead to less oral intake for children because they don't feel well, or they lose more fluids than that they are able to get in with diarrhea or vomiting or a combination of both, and dehydration is around the corner. So it's something that you need to be on top of.
Okay. Dr. Tilanus, something that is worrying me is, of course, the undocumented persons here on the islands, the illegals also, and of course not them only and their children, and most of the time there is a significant correlation between being undocumented or illegal and of course then being not insured for your health care in Sint Maarten. Can you give me an impression about how serious this issue is in the community of Sint Maarten, the amount of kids that you see that are uninsured that comes to your office, and how this is being worked out?
Yeah. In order to get a consultation, everyone is able to pay a fee, a consultation fee, which makes it possible to be seen. So either whether or not you are insured, if you are able to pay a consultation fee, you are being seen. Of course, patients have been seen also without payment. In acute cases, we will never leave someone unattended.
Oh, very good.
Any child that needs acute medical care will get medical care.
Mm-hmm.
So that is that nobody is left out in that sense.
Oh, that's very nice to hear that you still have this good heart with the hospital, of course, to take care of that group too, because these poor children, they cannot help that they are kids from parents that are illegal or undocumented. These
Another important role in pediatrics comes also from public health, and that's prevention of diseases, in which vaccinations come around the corner. Mm-hmm. The government of Sint Maarten made it possible that all children receive their vaccination, whether they are insured or not. Mm-hmm. So at the baby clinic in the Vineyard building, basically all children are being vaccinated. And because of that rule in place, the vaccination, the amount of percentage of children being vaccinated on Sint Maarten is quite good actually compared to surrounding countries.
Oh, that's nice to hear.
Almost 95% from the top of my head.
It's good that you're touch basing on the baby clinic that actually used to be by the roundabout in front of Carrefour here in Cahill, but now it is accommodated by the Vineyard building, as you said. What is the big difference between your outpatient clinic for the kids and the baby clinic? What is significantly the differences in service?
Yeah, well, as I mentioned before, pediatrics is all about monitoring growth and development. Mm-hmm. And what you see in pediatrics is, and that's quite absolutely different from adult medicine, the moment that a disease is starting to play a role, a disorder occurs, growth and development are being disturbed, and you see an abnormality in the growth chart. So healthy babies that are growing well are being monitored in the baby clinic. That the slightest change in growth and development, they refer the child to the hospital, to the pediatrician in this case, in which he or she, me in this case, will determine if further investigations have to be done, or sometimes even the child needs to be admitted or not.
So the baby clinic does more the screening and prevention, and
Exactly.
you are more caught in when things go wrong. Let's
Correct.
put it that way.
Correct.
Okay.
Yeah.
Good. Dr. Tilanus, next chapter. You are the pediatrician in Sint Maarten, and we want the best for the kids of this country. Where do you think some improvement can take place still in the future for the care of the children of Sint Maarten?
Yeah. I'm glad you brought this question up. Almost all countries have a so-called newborn screening, in which at the 5th day after birth, the baby blood is taken from the foot, so-called heel prick test, in which for a large amount of inborn diseases are being tested. The French side, for example, has this test in place. Our neighboring islands, Statia, Seba, and even Bonaire have these newborn screenings in place. These tests are being sent for the islands to the Netherlands, in which we usually receive, if there's anything wrong with that, in a couple of days a response. And if that's the case, in most of those cases, if you detect those diseases in an early phase, it's still treatable, and severe side effects and permanent damage to, for example, the brain can be prevented if a certain diet is being followed or a certain medication can be started. So it's a crucial thing that this test is going to be launched here, this newborn screening, in which the hospital, all children being born in our hospital should undergo that test, and that really should be part of the next election, the next program for Sint Maarten politics to think about that.
And of course, if it's for the kids, we have to work hard on it to realize it's for the kids of Sint Maarten. Do you think the implementation of the heel prick at this particular moment, is it a matter of not having the goodwill, or is it a matter of financing? What do you think?
I'm not very sure. You see that the surrounding islands, Statia, Seba, and Bonaire, which have become the best islands, as you know, are more under direct influence from the Netherlands, in which you see that that's a little bit more better organized, and they see the advantages of it. The Netherlands, the Dutch government covers those tests. So yeah, it should be possible also for us to do this. Of course, to changes after 10-10-10, Sint Maarten has a different position obtained in the kingdom. But I think that this is so important that we should be able to launch this, and that should be possible.
Yeah, and it's good that you say it that way, because as a matter of fact, we are one people in one kingdom. And it should be correct also if we give the kids of Sint Maarten the opportunity to be screened as in other countries in the kingdom. I think it will be very equivalent for all parties if we try to synchronize the screening for example, this heel prick. I have another question for you. As a surgeon, Dr. Tilanus, I'm encountered with a lot of complications of the sugar disease, the diabetes. And it's alarming how many people are consulting me with actually complications of the sugar disease, being wounds at especially the feet that do not heal, people that get in a way with this problem that they have to amputate parts of their foot or lose some toes. We see in adult a high incidence of diabetic disease. Do you see that also in kids, that there are a lot of kids with sugar disease here in Sint Maarten?
Diabetes in children, of course, does occur. Some children are developing diabetes as new phenomenon in their life, and there are also children that are so severely obese that develop actually the so-called type 2 diabetes, which you usually see in adulthood.
Yeah.
So both options are possible, and both need different approach and treatment forms. If in the pediatric age group, a diabetes child is being treated with proper insulins and guidance and diet, you can have basically a normal life, and it's a chronic disorder. Technology is very advanced. We don't have the insulin pump here on the island as yet. That needs a lot of more organization to have that going. But there are options to even continuously measure with a small needle in your skin continuously the glucose levels in your blood, and that makes it much more possible to much precise regulate your sugars, and then the chances that those severe long-term complications that you as a surgeon see from the food are being prevented.
Yes. And most of the time, once children have a diabetes disease, most of the time is the insulin that you use to treat them. It's sporadically that they go on tablets, right?
Yeah, the tablets is usually what you see in the treatment of type 2 diabetes.
Yes.
And type 1 is really where you have a lack of insulin because the pancreas is not functioning anymore. The insulin-producing cells of the pancreas are being destroyed.
Yeah.
They really have to be replaced with insulin injections.
Mm-hmm. And most of the time, the kids that start very young with this disease, they have to be treated with insulin in general.
Correct. Yeah, definitely.
Very good. Okay. Dr. Tilanus, we are working on a new hospital. Do you have specific wishes on that alley department of pediatrics that you say, I would like to see the organization or the setup of the pediatric ward in a very good, efficient and practical way for the kids of Sint Maarten? Do you have a idea what you would like to see in that ward?
Yeah, well, I've been very closely involved also with the setup from the new pediatric department, and I like the term mother-child center, in which you already see that the relationship between mothers and, for example, newborns are much more trying to be kept together as much as possible. So babies are going to stay more by the mom. You try to avoid the separation as much as possible. So you see that mother and child are going to be more together. Also for breastfeeding mothers, you will see that there will be more facilities for being one-on-one with your baby. There will be a more closer relationship also physically between the two departments, so the pediatric ward and the neonatology ward and the delivery rooms and the maternity ward, OBGYN, obstetrics, are more integrated together. So I think that's going to be very beneficial. The patient rooms for older children, of course, always one parent is able to stay with the child. The parents will have now more privacy for those that have to stay over. So not with multiple parents, with multiple children in one room, but each one has his own separated room. And I think that will also be experienced by parents as very pleasant to have at least a little bit of more privacy.
Dr. Tilanus, this is a very interesting interview with you. As everybody knows, we are colleagues of each other in the hospital. It's an informative program that the URSM is trying to present to the people of Sint Maarten. I should not do that, but I still want to make use of that opportunity because Sint Maarten is listening. And I would like you never know if there is somebody outside there that would like to help the pediatric ward of Sint Maarten Medical Center. And do you have a small wish list of something that is very high in the list of things that you would like to? You never know if there is a big sponsor outside there that could help us with our sick children. So I think this is the moment that I'm offering you just to make use of this opportunity to say, the pediatric ward would like to have this or that. And I think this is your moment to abuse of the opportunity.
I think one of the first pediatricians in my career was Dr. Hoekstra, and he mentioned the importance of toys for children. So even when they are sick, it's extremely important to have toys. And if you look at our pediatric ward, I think there should come even a better play corner where toys are available, where parents can, of course, still supervise and watch their children, but there should come more a playground. We have some few things outside, but it's very limited. I think that can go much better. And even better would be also a person that is able to play with those children, give them attention, or older children.
Voluntaries.
Okay. To do homework with those that have to be admitted for over weeks to sometimes months. It doesn't happen often, of course, but there are children with conditions that need a longer treatment, for example, the osteomyelitis, bone infections. So they are a longer time in the hospital, and then you really want to see that they are being treated not only for their disease, but that they also continue to develop themselves with ongoing education. So a playground and an activity person for children.
And toys.
And toys.
Of course. Dr. Tilanus, time is running on us. It was a very interesting interview that we had today with you. And before closing, once more, out of my heart, I want to thank you in the name of all the children of Sint Maarten that on a daily basis are being taken care of by you and your team. Of course, we must not forget the nurses that is also part of your team.
For sure.
To helping the poor kids that are in need. Once more, Dr. Tilanus, in the name of the people of Sint Maarten, we would like to thank you for your effort, for your professionalism, for the fact that you're always standing ready to help the sick kids of Sint Maarten. Really, out of my heart, thank you very, very much. And once more, I would like to thank you for being here today with us in our radio program, You Are Sint Maarten.
Thank you very much also.
Dear people, we are at the end of our radio program. Thank you for being today with us. I'm looking forward to have you back in our program next week, Wednesday, between 6 and 7 o'clock in the afternoon on Radio Mix 94.7 FM. Have a good night.